Hello and welcome. Today we have Dr. Linda Bluestein, an advocate and author around hypermobility disorders with a special focus on dancers and performing artists. She's a leading voice through her podcasts Bendy Bodies, multiple book chapters, and international lecturing on related topics. Through education, mentorship, and clinical care, she works to help dancers and other hypermobile individuals thrive and not just survive. And we're really excited to hear what she has to say today. So, Linda, welcome. And let's start off by telling us why hypermobility. What's interesting there and what's kept you excited, or what are you excited about now?
Oh my gosh, it is so exciting. I first really started to dig into hypermobility in about 2012 when I first realized that I had hypermobile EDS because I had a Tarlov cyst, and that one thing led to another. But anyway, I opened my practice in 2017, and even from 2017 until now, there's been so many changes. So it's super exciting. We're learning that the immune system is connected and probably plays a really large role in how our connective tissue works. So the whole body is connected. We know that hormones are a factor. We know that mast cells, which are part of your immune system, that they're a factor. And of course, COVID has also changed things for a lot of people. So when you get an infection or a vaccine, it changes your immune system. Your immune system reacts, and that can affect how your tissues behave. So it's an exciting space to be in. Things are changing really rapidly. We're getting a lot more new information. Of course, there's many more things that we don't know, but it's really exciting to be working in this space.
So you're saying it's not just muscles and joints.
Oh, no, definitely not. These are systemic conditions. Yeah, we have connective tissue everywhere. So people who have connective tissue disorders or joint hypermobility, they can have symptoms anywhere in their bodies. So they can have, gastrointestinal problems or fatigue, trouble sleeping. They have, subluxations, dislocations, which in circus, having super bendy joints can be super beneficial, of course, until it's not, right? So if you're a dancer or a circus artist, it's great until it isn't. It's fun until it starts to hurt. And my goal is to help people perform their best, as I know is your goal, and help them stay in the activity that they love for as long as possible, but also make it so that they're not, having difficulty walking when they're in their 40s and 50s. We want them to be able to move for as much as possible for as long as possible.
Amazing. So you've kind of touched on this already, but if there's an artist or coach listening to this, what's one small shift in perspective, maybe around hypermobility or about training in general, or a technique that they can take away from the things that you talk about that might improve their practice or make training easier?
So, what I would love to see coaches and teachers start to ask is not just, can they do it? Can this person do this particular skill? But if they can do it, at what cost? Is it something that they can do and they can do over and over again and they can do it safely? Or can they do it? They can do it once, they can do it safely. What is the cost to them, to their tissues? What does this look like on this particular body? And it's not going to be the same for every person's body.
Yeah, so I guess it's not just can you do it, but how are you doing it? And are you able to control it? Are you able to live in that
Right.
movement or just throw your body through it?
Right. Are you
Yeah.
just surviving it?
Mhm.
You're doing it, but you're barely surviving it. And you kind of got lucky, or, by your own skill, like you're able to do it, but it's really not in your best interest, especially if you're doing it on a more repeated basis.
Yeah, and I guess because you're talking about how it affects all the other systems in the body or how all the other systems in the body affect the tissues, there's so much to also think about, not just the doing of the activity at that moment, but then what happens?
Right.
Like the aftermath, like the night after, the day after, the week after, and how the body reacts as well. So it's such a cool, interesting way of having to think about things. It's not just the can you do it, but should you and what happens.
Right. Right. Exactly.
Okay, so now let's flip the script a little bit, and you get to put your doctor hat back on. For our clinicians listening, what is the most overlooked systemic factor or other factor that clinicians might miss that might cue us into there's a hypermobile person in front of us? Or what should we be asking our hypermobile person to get a more robust picture of who they are?
So even just looking for joint hypermobility in the first place is huge and amazing. So anyone listening who's like, I already do, or I'm going to start looking for joint hypermobility, that's fabulous. If you also can be thinking about, how does their gastrointestinal system work? Are they, able to eat foods pretty normally? They're not having postprandial or post-meal symptoms. Are they kind of going to the bathroom maybe once a day, generally speaking, easy to pass. They're not having problems with severe constipation, diarrhea, et cetera. Are they having bloating after they eat and that kind of thing? Because GI problems are really, really common. And if you think about it, we do have connective tissue all through our GI tract. Another thing that's super common is dysautonomia, which is dysfunction of the autonomic nervous system. And people will go years and years, if not decades, with undiagnosed symptoms related to both connective tissue disorders and dysautonomia, in particular POTS or postural orthostatic tachycardia syndrome. So if you're working with an artist and they have difficulty, they get dizzy when they stand up, they feel like they have difficulty with temperature regulation. They feel like they have brain fog a lot of the time. Those things can be related to dysfunction of the autonomic nervous system. Now, of course, anybody, if they've had a flu or they just haven't drank enough fluids, like they can get dizzy when they stand up, right? We're talking about this happens on a recurrent basis. And I do want to point out that you do not have to faint in order to have POTS. There is a big misconception that people with POTS faint. No, you don't have to faint. You can feel dizzy, and that's plenty enough. So if they have orthostatic intolerance, they have tachycardia, palpitations, difficulty with upright posture, they have difficulty standing in line. That's a really great one. Like, when they're standing in line, they kind of fidget, they're moving around a lot. Could be ADHD, of course, which is also very much interconnected with joint hypermobility. But if someone's having difficulty standing in line or standing still, it could be because their autonomic nervous system isn't functioning properly.
Interesting. Again, it's not just the tissues. It's kind of considering that whole person, and especially in circus where we're turning upside down and right side up so many times, it might
Right,
come up. Amazing.
right.
Okay, last question for you. If folks are interested in coming to your talk at this April's Circus Science Symposium, what is one thing you hope that they learn from that talk? Maybe not like the whole explanation, but like the objective, that bullet point.
What I hope that they learn is that this is a spectrum and that there are many, many people who fall somewhere on the spectrum and no two people are alike. So there's a saying, if you've seen one EDS patient, you've seen one EDS patient. So I want to let people know the whole variety of things that we should be looking for and not be thinking, oh, but I saw somebody once before who has a diagnosis of hypermobile EDS. Now I'm looking at this other person and they don't look like that first person. Therefore, they don't have hypermobile EDS. That's not true. Unfortunately, these conditions are very heterogeneous. So understanding the full spectrum of things that we should be looking for, I think will be really helpful. And I'm so excited to see people in this symposium. I think it's going to be great because everything that you put on is so fabulous. And thank you so much for including me.
Yeah, we're really thrilled. Thank you so much for taking time today to talk to everyone, to me, and to help us learn and continue to learn about working with hypermobile bodies from the artistic background all the way through the medical background that you bring to the table. So thank you so much.